Sexual and reproductive health awareness is critical for maintaining well-being, yet many infections remain poorly understood. While common infections like chlamydia, gonorrhea, and syphilis are widely recognized, Veillonella genital infection represents a rare and often underdiagnosed bacterial infection that can affect the genital and reproductive systems. Veillonella is a genus of strictly anaerobic, gram-negative cocci bacteria that are normally found in the oral cavity, gastrointestinal tract, and female genital tract. Under normal circumstances, these bacteria live harmlessly alongside other microbiota. However, under certain conditions, Veillonella species can act as opportunistic pathogens, leading to infections that may involve the urethra, vagina, and pelvic region. This WUTNews video aims to provide a detailed understanding of Veillonella genital infection, including the history and scientific discovery of Veillonella, how the infection develops in the genital tract, symptoms in men and women, risk factors and global prevalence, transmission methods and modes of contagion, diagnosis and laboratory testing, treatment approaches and antibiotic therapy, prevention strategies and protective measures. Educating the public about Veillonella genital infection is important because early detection can prevent serious complications, including pelvic inflammatory disease, abscess formation, infertility, and systemic infection. Subscribe to WUTNews for regular updates on sexual health, rare infections, medical education, and global health awareness. Understanding Veillonella bacteria. Veillonella bacteria are anaerobic, gram-negative cocci that typically exist harmlessly in the human microbiota. They are commonly found in the oral cavity, contributing to normal oral flora, the gastrointestinal tract, assisting in the digestion of lactate, the genital tract, where they coexist with other microbiota. Veillonella species can become pathogenic under specific conditions, particularly when the normal balance of microbiota is disrupted. Some of the clinically significant species include Veillonella parvula, Veillonella dispar, Veillonella atypica. When overgrowth occurs, these bacteria can cause inflammation, infection, and tissue damage, particularly in the reproductive tract. They are often involved in polymicrobial infections, meaning they occur alongside other bacteria in mixed infections. Historical background. Veillonella was first identified in the late 19th and early 20th centuries during studies of anaerobic bacteria in the human body. Initially, Veillonella species were primarily associated with oral and dental infections, such as periodontitis, gingivitis, and abscesses. During the 1960s and 1970s, researchers began detecting Veillonella in urogenital infections, particularly in women with bacterial vaginosis and postpartum complications. This highlighted its role as an opportunistic pathogen in the genital and reproductive systems. Despite being identified over a century ago, Veillonella genital infections remain underreported due to the anaerobic nature of the bacteria, which makes laboratory culture and identification challenges. As a result, many infections are diagnosed indirectly through symptoms and co-infections. How Veillonella causes genital infection. Veillonella genital infection occurs when there is a disruption in the normal microbiota of the genital tract. This imbalance can allow Veillonella to overgrow and invade local tissues, causing inflammation and infection. Triggering factors: antibiotic use that disrupts normal flora, hormonal changes during pregnancy, menstruation, or menopause, poor genital hygiene, weakened immune system, HIV, chronic illnesses, childbirth or postpartum conditions, urological or gynecological surgical procedures. Once the bacteria multiply excessively, they can cause symptomatic infections, ranging from mild irritation to severe pelvic or genital inflammation. Transmission. Veillonella genital infections are primarily opportunistic rather than strictly sexually transmitted, but sexual activity can play an indirect role by altering the balance of normal genital microbiota, causing minor trauma to genital tissues, facilitating the migration of bacteria. Direct sexual transmission is considered rare, though poor hygiene, untreated infections, and exposure to contaminated medical instruments may increase the risk. Symptoms of Veillonella genital infection. The symptoms of Veillonella genital infection vary based on the individual, gender, and severity of infection. General symptoms: unusual or foul-smelling genital discharge, redness and swelling of the genital area, pain or burning sensation during urination, lower abdominal or pelvic discomfort, fever in severe cases. Symptoms in women: vaginal discharge with a strong odor, pelvic pain or discomfort, pain during sexual intercourse, associated bacterial vaginosis or pelvic inflammatory disease. Symptoms in men: urethral irritation or mild discharge, pain or pressure in the genital region, discomfort during urination. Some individuals may be asymptomatic, which can allow the infection to progress unnoticed. Complications of untreated infection. If left untreated, Veillonella genital infection may lead to pelvic inflammatory disease, PID, in women, infertility or pregnancy complications, formation of abscesses in the genital or pelvic region, chronic genital discomfort, rarely systemic infection if bacteria enter the bloodstream. Early diagnosis and treatment are essential to prevent these complications. Global prevalence. Veillonella genital infections have been reported worldwide.
Higher recognition occurs in countries with advanced microbiological testing facilities, high prevalence of bacterial vaginosis or reproductive tract infections, widespread awareness of sexual health. In many developing countries, these infections may be underreported due to limited laboratory resources and lack of awareness. Diagnosis. Diagnosing Veillonella genital infection requires clinical examination and patient history, microbiological cultures under strict anaerobic conditions, microscopy for bacterial morphology, imaging in cases of suspected abscess formation. Because Veillonella is strictly anaerobic, laboratory identification is complex, and infection is often detected in combination with other bacterial infections. Treatment options. Treatment involves antibiotics effective against anaerobic bacteria, including metronidazole, clindamycin, combination therapy for polymicrobial infections. In severe cases, surgical drainage may be required to treat abscesses. Restoring normal microbiota and addressing underlying health issues is crucial to prevent recurrence. Prevention strategies. Preventing Veillonella genital infection focuses on maintaining genital health and minimizing risk factors. Practice good genital hygiene. Avoid unnecessary antibiotic use. Safe sexual practices. Routine gynecological and urological checkups. Maintain overall immune health through diet, exercise, and stress management. Education is key because many infections are asymptomatic and may progress silently. Why awareness matters. Though rare, Veillonella genital infection can have significant consequences if untreated. Awareness empowers individuals to recognize early symptoms, seek timely medical intervention, protect reproductive and genital health, prevent chronic complications. Final words from WTU News. Veillonella genital infection may not be widely known, but understanding its causes, symptoms, treatment, and prevention is essential for reproductive health. By spreading awareness, we can ensure early detection, proper treatment, and prevention of complications. Subscribe to WTU News for updates on sexual and reproductive health, rare genital infections, STIs and STDs, global health awareness, medical education. Like, share, and comment to help others stay informed and protect their reproductive health. Stay safe, stay educated with WTU News.